All right. So this is your question number 4 of your INA pattern quiz. This is again a very good example of an integrated question where we have a child. So 3-year-old child is presented by a pediatrician, referred by a pediatrician, that this child is having 7-day history of fever of unknown etiology, and you have lot of features here. Can you see? We have conjunctival injection, then we have polymorphous rash, also erythema, edema of the palms and soles, periangle desquamation, cervical lymphadenopathy. We have injected pharynx and the tongue, fissuring of the lips. So we have got lot many things. So basically, if you look at the question, it seems that it is a question of the pediatrics, but ultimately they'll end up asking something else. They say that in the eyes we have bilateral anterior uveitis. So which of the following is the studies is most appropriate? So can you actually tell me that what is this finding? What is the diagnosis of this child? Child is having a very typical syndrome. He is having a 7-day history of fever of unknown origin. We have bilateral conjunctival injection, polymorphous rash, erythema, edema of the palms and soles. Then we have desquamation, cervical lymphadenopathy. So there are so many things. So exactly, you people are correct. So you are having something which is called as the Kawasaki disease. So that is very peculiar and found in the pediatric population. You always study about Kawasaki disease. So we have got this Kawasaki disease where the patients, can manifest as active chorioretinitis. And also, and if you see this Kawasaki disease, we have the involvement of the heart also, skin, as well as mucous membranes. So basic problem that you get in cases of Kawasaki disease is your vasculitis. That is the main pathology. And you can have this, if you look at the involvement, basically skin is involved, mucous membrane is also involved, and then very important is your heart. So if you look at the picture, we have the involvement of so many things here with respect to the Kawasaki disease, where you are having a systemic vasculitis, and we have the involvement of the skin, mucous membrane, as well as the heart. While this vasculitis is the most serious complication, and this will be involving your coronary arteries. So basically we are worried about the involvement of this coronal artery. And how will you see? So this involvement of the coronary artery could be seen by electrocardiogram, two-dimensional echocardiography, chest x-ray, or HLA-B27. So obviously you will be able to see this with the help of two-dimensional echocardiography. So basically what I am interested in, if I am doing this, if I am doing this two-dimensional echocardiography, I am interested in knowing about the ventricular function. What is the ventricular function? These are the things that could be asked in future also. So number one, you can find about the ventricular function. Then if there is any pericardial fluid, then you can also find out about that. And obviously if there is any coronary artery aneurysm, so all these three things you can find out with the help of echocardiography. And that is the reason the answer to this question is two-dimensional echocardiography. So I hope you have understood this. Again, a very important question and a very good example of an integrated question where you are having the integration of the pediatrics, and then you are having the integration between the pathology as well as your ophthalmology. So good evening, and we are trying to discuss the quiz question because they were the latest INI pattern questions, and I want you to understand the concept behind it. And they are very innovative kind of questions which are giving you unique simulation of the questions that are expected in your future examinations concerning the pediatrics, pathology, ophthalmology. So 3 subjects in a go. So thank you guys, and hope to see you in the further sessions discussing the other questions. Thank you.